Hi, everyone. Thanks so much for joining us again. We are very excited that you carved the time out of your calendar to join us for Day to Day with Davis Advantage, How to Ensure Success. My name is Jackie White. I am the marketing manager for some of our nursing products here at FA Davis. I am joined with Kim Harding from Colorado Mountain College. She is going to be our real host for the day, walking through some of her experiences using Davis Advantage, why she chose that specific product, what benefits it has for not only her but her students, and how she uses it in the classroom, showing how to keep your students engaged, showing how to implement that type of active classroom in different ways. The nice thing about Davis Advantage is it is super flexible and really customizable so that everybody can use it a little bit differently to meet your unique program goals. So just to get started, I want to cover a couple housekeeping items. If you have any questions during the presentation or any comments, feel free to put them in the Q&A box. It's located at the bottom right-hand corner of your screen. We'll make sure to pause during the presentation or get to them at the end. So if you have something that comes to your mind, feel free to type that in the Q&A box. We definitely want to keep this presentation interactive, and we want to hear from you. We'll also have a short survey that pops up at the end of the webinar today. Take 2 minutes, fill that out so that we can make sure to get you access to Davis Advantage, or if you have some support, maybe technical questions, we want to make sure that we can connect and get you exactly what you need in order to get started or further develop using Davis Advantage in your classroom. I know some of our attendees today might be using Davis Advantage. Some of our attendees might just be interested in what Davis Advantage and what does personalized learning and what does personalized teaching mean and what can it do for your course and curriculum. That is great. We have Davis Advantage not only for pathophysiology, which Kim is actually going to use as a test case today. We have Davis Advantage for Med-Surg. And just this month, we are expanding our product line and having Davis Advantage with fundamentals. So depending on what you're teaching, think about how Davis Advantage can really be used in the classroom, how it can really target today's learner and get them participating, get them collaborating with each other, get them engaged, and how it can really change teaching in using Davis Advantage. Having that technology in the classroom, you're really going to be able to step away from that traditional lecture and make that classroom more active. So at this time, I want to turn it over to the star of our presentation, Kim, to really walk us through the day-to-day and all of her experiences and all of the successes that have come out using this product in the classroom.
Okay, great. Hello, everyone. Thank you so much for that introduction, Jackie. I really appreciate that. Just a little bit about myself. I teach at Colorado Mountain College, and I teach a 200-level pathophysiology course. But as Jackie was saying, I'm really hoping everything I discussed today can be applied across the board to anyone using the Davis Advantage programs. I do want to be upfront. I did assist in the design of the Davis Advantage pathophysiology materials, but I never told my students that I did that. So any feedback that I give to you as far as what students have commented in regards to this program is not biased. They're certainly not trying to earn a higher grade or anything, since they don't even know I really participated in this. I do have to say one of the reasons why I was excited to help develop these materials is because I felt it met such an instructional and student learning need in such a effective and efficient manner. I couldn't wait to be a part of this. And I hope as I outline the program and then how I use it day to day in the classroom, you also gain that sense. Or if you're already using it, perhaps I'll be giving you some ideas of, oh, I could be doing it this way. and it would assist you both from an instructional standpoint and then always our driving concern, helping students become more effective learners. So if you're not familiar with the Davis Advantage program, again, I'm showing you from the pathophysiology perspective. One of the things I absolutely love is that you can choose the course content that you would like, and it's simply an on-off little switch here. And I think that's so important in the subject matters that Davis Advantage is associated with because of the volume of content. We really don't always get to include everything that we'd like within a curriculum. Certainly in the world of pathophysiology, it's usually a one-semester course. So you're dropping down anatomy and physiology, which was 2 semesters, now into 1 semester. And you really have to begin choosing what you want to keep in the course and what you don't. And Davis Advantage makes that so very simple. Again, all you have to do is hit on or off whether you want to keep that content in the course. Okay. Another advantage that I absolutely love is you select the order of the course content. As we know, again, anatomy and physiology, it tends to be a very prescripted sequence of subject matter where when I was looking at different pathophysiology materials, there's a wide variety, what chapters certain books start with, what chapters are included. And Davis Advantage allows you to set the course content in the order that makes the most sense for you. All you have to do is choose something such as this and do a simple drag and drop, and it will basically sequence the course in the order that you like. An example I can give, after the acid-base balance, I actually bring up the diabetes chapter because it really helps students understand diabetic ketoacidosis. I find those to be a good tie-in. So I didn't show it here, but that's what I end up doing, and I really like how I have that flexibility to set the sequence of my own course. So what's included with Davis Advantage? Every topic has a pre-test, a video, an activity, and a post-test. And I'll go through these a little bit more. But one of the things I enjoy about this, it stays consistent every topic, and students can understand what to expect. Obviously, they take a pre-test to see what their initial knowledge is. There's a video, and this video also contains a transcript. So some of my students just view the transcript, cut and paste it, and use it as a great set of study notes. Then there's an activity to do, and these activities, when we develop them, really vary. It's not the same activity type for every topic, and students have spoken to me. They really love the variety associated with these activities. And then finally, a post-test. This is a way for you and as an instructor to learn about how your students are doing. I'll show you how those results are posted, and it's a great way for a student to feel comfortable that they really did gain the knowledge. One other shout out I have to give is when I first was talking about developing these materials, they said the videos had to be less than 5 minutes in length, or around 5 to 6 minutes. And I thought, oh my goodness, how much can really be done in a 5-minute video? I have to tell you, more than I ever imagined. I have students really rave about these videos, that they don't waste their time. We've all done this even in our own life. Click on a video that's 11 minutes long and we get 3 minutes into it and we're already stopping it. I have heard no complaints about these videos. Instead, it's always been very positive as far as what students can learn. Okay, so how are students assessed, or what feedback do you get as an instructor? Well, both the student and the instructor, a student would obviously just see their scores, a student is awarded a thumbs up or thumbs down for successful completion of each activity. So when they do the pre-assessment, the video, the activity, and the post-assessment, certainly the pre-assessment, you'd expect a thumbs down. They haven't studied the material or anything such as that. And how I incorporate this into my class is really simple. I just award 5 points for each of these segments completed, so it's 20 points total for completing any topic I have assigned. Okay. What I really wanted to discuss today, and again, it could be applied to any of the Davis Advantage programs, is how do I integrate it day to day in the classroom? It's one thing to see the setup of these types of programs, but then you're sort of left wondering, well, what does it really mean, and how easy is this going to be to incorporate into my classroom? And the 2 driving questions: does this make me a better teacher, and does it help my students learn more effectively? And when I looked at how I was using Davis Advantage, I realized I was using it in 3 different scenarios, as far as what was setting the foundation, and then what was helping students as far as reinforcing the material. And if you look at these three scenarios, sometimes I set the foundation in lecture, and I use Davis Advantage to reinforce what I'm doing. Sometimes I actually have Davis Advantage set the foundation, and then I reinforce what students have learned in lecture, and then sometimes I'm choosing to use both in both scenarios. And what I'd like to do today is take you through exactly what I mean by this and how it has helped me become a more efficient and effective instructor. So the first scenario, I want to set the foundation in lecture, and I'm going to use Davis Advantage to reinforce the topics. So the example I'm choosing is Chapter 25, Diabetes Mellitus. And, you know, if you've taught this before, you know it's always a challenging chapter to teach or challenging topic. You have learning about type 1 and type 2, acute complications, and so on. And I know they're not going to be able to gather all of this information easily in lecture. And this is where Davis Advantage can help. Okay. First of all, I organize my lectures to follow the content order of Davis Advantage. If you look here, it's organized types of diabetes and diagnosis, and then you go into short-term complications and then long-term complications. And then this is what I do. The first day of the sequence of courses, if you will, that I'm teaching on diabetes, I lecture on types of diabetes and diagnosis. So I'm hitting this first aspect. And then what I do is assign Davis Advantage topic for homework before the next class. So they hear it in lecture, they go and do the Davis Advantage topic where they're seeing a video, they're completing an activity, and they're completing a post-test. So they've already seen it twice. And then the third advantage is Davis Advantage has what is known as personalized teaching plans. These are outstanding opportunities to help students really grasp those content questions that are a little bit more difficult. It allows you some space to work with students. And as far as these personalized teaching plans go, okay, I think they're one of the strongest features of Davis Advantage. I actually had one teacher talk to F.A. Davis and said these teaching plans allowed her to become the teacher she had always wanted to be. And that just so touched my heart. And just to let you know what I mean by these personalized teaching plans, there are 3 teaching activities along with answers, along with student sheets that are provided for every topic. So every topic you assign, you actually have 3 options of additional activities you can do with your students. Okay, so as we're in the diabetes chapter, looking at diabetes types and diagnosis, I want to show you what I mean by these personalized teaching plans. So I lectured on this, I assigned the topic for it, and now I want to see, okay, what do I want to do in the next class session with them? One of the options I have is just these little series of questions and prompts that I can assign in small groups or to a class as a whole, just to quickly review the concepts that were covered and lectured in the Davis Advantage topic. One of the reasons I like this is because it's just a quick review to get us off on the right foot on that following class session. The second personalized teaching plan associated with this, it seems sort of silly, but it's actually fun, I've done it, is to have students work in pairs and draw a visual representation of normal glucose regulation, and then ask them to depict what happens in type 1 and type 2 diabetes. It does seem very simple. It only takes 5 or 7 minutes, but the one thing I really have liked about these, I don't know about you, so often I say, okay, are there any questions? And I'm just met with silence, like crickets chirping. When they break up and do these small activities, it actually allows them some space to ask some questions, and it allows you to clarify for them any areas of difficulty. Okay. And this is the third option that is a personalized teaching plan with diabetes, the types and the diagnosis. This is the one I normally assign, and I absolutely love it. Again, it takes us about 10 minutes to do it, but basically students divide up into small groups or pairs, and they create a patient scenario associated with diabetes. They're given a word bank, and out of these words, they have to choose 10 as they write up a scenario of how a patient may really present. I have to say it's a lot of fun. It gives them a chance to be creative. We sometimes end up laughing at some of the strange stories they come up with. But it's an easy way as an instructor to hand out an activity and to actually help everyone reconnect with the material in an additional way. So with this first scenario of how I use Davis Advantage, you can see right away there are 3 points of intersection for the students with this topic. There's the lecture I give, the Davis Advantage a topic, and then the personalized teaching plan. Again, you have 3 options there. And it's just a great way, again, to have them intersect with this material as a class as a whole and for you to clarify any misunderstandings. Once I do this for types of diabetes and diagnosis, I begin the next section, which is short-term complications, and sort of follow a similar sequence. I hope that makes sense to you. Okay, that's great. That's when I set up the lecture and I'm using Davis Advantage as a reinforcement. Another scenario that I absolutely love to use is when Davis Advantage sets the foundation and then I use lecture to reinforce what the students have learned. And I use this primarily when I do feel concepts are so difficult to grasp. I really do want my students to have some experience with the material before I lecture. This would be the typical flipped classroom, if you will. And my number one example for this in the world of pathophysiology, although I can see it applying elsewhere, is with valve disorders. If you've ever lectured on valve disorders, you know it's a very terminology-heavy segment, not that they all aren't, but students can quickly get lost in the terminology. You're using diastolic versus systolic murmur, insufficiency, stenosis, backward-forward effects, and you can literally just see the students' eyes glaze over as these terms keep flying at them as they're trying to understand the valve disorders themselves. This, again, is where Davis Advantage can come to help. All right. So I assign the valve topic, heart valve disorder topic, prior to lecturing. And that means the students have done the pre-test and then they watch this video on heart valve diseases. I have gotten so much positive feedback about this video, and it seems very silly, but the heart, as you would expect, is drawn out. But what we did is have like the atria and the ventricles, and this little yellow thing is the valve, it's the wall. And students will really, and then we showed blood cells moving back and forth, or blood moving back and forth across this wall, sometimes with difficulty, for example, stenosis. Students will actually remember this and bring this up to me that, oh yeah, I saw that in the video with the cells moving back and forth. So they already have some work, if you will, with the material before I lecture, and then that's solidified, if you will, with the heart valve disease activity. So a lot of usage with the concepts, the terminologies, and then applying them with the activity even before they come to lecture. Okay, so they've arrived seeing the video, completing the activity. We then can spend time reviewing key terminology. So again, there's not that blank look where they're like, oh my goodness, all this terminology is flying at me. Sometimes I actually watch the video again as a class because the videos are short. It doesn't take up a lot of class time, and I can stop the video if there are questions, and hey, you know, it gives us a common visualization point. And then other times I begin the class with a personalized teaching plan because they did the video and activity. Sometimes I want to say, okay, you did all of that. Here's a personalized teaching plan activity. Let's spend some time as a class with this before I actually begin lecturing on this material. And by far the most important point is that students feel empowered rather than lost, wondering how, you know, because sometimes they so doubt themselves and they wonder why they're not catching up on the material as quickly as they should or whatever. Davis Advantage helps eliminate a lot of that. And even areas where they feel a little confused, they know they have an easy to go to resource to help them out. So anyway, the personalized teaching plan I use with the valve disorders is this one. Again, it seems extremely simple, but we'll start class and the students are assigned these different valve disorders. They draw a heart, they show the different structures of the heart, and then they show how this valve disorder may manifest. Very similar to what they just witnessed in the video for that assignment. Okay. The third scenario is when I'm splitting up the material most between lecture and Davis Advantage. I use this scenario when I feel I have limited lecture time to spend on a topic. And again, I think this is one of the things that confronts those of us who teach pathophysiology or med-surg nursing or whatever, simply the volume. You have to make decisions along the way, and I do feel much more confident in the decisions I'm making because of the support through the Davis Advantage program that I know my students have. In this scenario, I want to handle some but not all of the information on the topic in lecture, and then the remaining material solely covered by Davis Advantage. And I'll give you an example of where I apply that. By far the best example of this is there's a Davis Advantage topic known as cardiac function and assessment. Great. Introduction to cardiac topics. But this is where my concern is. Students should have covered this in anatomy and physiology. So I don't want to take a lot of class time reviewing these concepts. On the other hand, before I go into heart failure, I need to make sure that they're up to speed with this terminology they may have forgotten from anatomy and physiology. So what I do is assign cardiac function and assessment topic through Davis Advantage, and then I don't have to address it further, okay? I assign the topic before I lecture on heart failure. I very quickly may review cardiac function and assessment with perhaps a personalized teaching plan, which I put here. But then right away I can move on to heart failure, and I'm not taking up my lecture time reviewing things they really should have had in anatomy and physiology. Another place where I'll sort of split the material, if you will, between Davis Advantage and my lectures are bleeding and clotting disorders. I don't know where these fall in your sequence as far as your classes go, but this is one of the topics I constantly feel I'm hurrying through a little bit. And so what I end up doing is spending a lot of time on the basic pathology, how these states, a bleeding disorder, a clotting disorder, will present, or any of the hematologic disorders. What's the underlying basic pathophysiology and how that will present in signs and symptoms and clinical presentation. But there are really many specific diseases associated with bleeding or, for example, clotting disorders or any of the hematological disorders. So how do you find that balance? Well, Davis Advantage has helped me find that balance where, again, I spend the most of the time on the basic pathology. But if you look here, disorders of platelets, hemostasis, coagulation, you can see the very specific diseases are explained clearly for students. And then there's an activity to really reinforce what the students have learned through the video and also my lecture. It's just allowed me to not feel like I just have to fly through these and lecture. I can touch on them and then really direct the students that Davis Advantage will help further their knowledge with these. And I can feel a lot more confident that my students will be getting the material at the level I feel comfortable with. One little side note here, I don't know what everyone's teaching scenario is. I'm talking about in-person classroom instruction, look at this video before the next class and such, but I do realize some also teach online. I actually teach about 100 students online per year, and I have used Davis Advantage seamlessly in this format. It has a very short learning curve for students, which you absolutely love. You don't want to take time as an instructor having to walk students through a difficult platform. Very easy setup. And as far as the ebook goes, or the textbook, I've heard no complaints. And if your students are like mine, if they do not like a textbook, you'll certainly hear about it. So it is very easy to integrate Davis Advantage with online learning. There are PowerPoint slides, obviously instructor resources provided. I set up little mini lectures around that, signed the Davis Advantage activities, different quizzes and case studies. And if you use like WebEx or whatever for your online instruction, it's very easy to integrate Davis Advantage, the videos, the personalized teaching plans, and so on with students even across the distance learning format. Some further notes, how you can, again, expand the usage of Davis Advantage in your courses. The personalized teaching plans, these can be assigned as homework assignments. I've done that. There's a couple lectures I had to miss once, and I was looking for some homework assignments, and I thought, why don't I just give them some of these personalized teaching plans? You don't necessarily have to do them as a class, and they were absolutely wonderful in that way. They are also wonderful for exam review activities. Sometimes you're just looking for those things to check everyone's knowledge prior to an exam. These are very, very quick and easy to use. Of the three provided, I usually only use one within my initial lecture sequence. So that means I have a couple other options students haven't seen that we can use to review for exams. Okay. As far as exam preparation, activities for each topic are an easy-to-use in-class review for exams. Sometimes I'll bring up the activities that the students have already done, but we'll go through them really quickly saying, okay, let's look at these again and test our knowledge before our test, okay? And then also the post-assessment questions in Davis Advantage, I will sometimes pull those back up and we go through those and say, okay, why is this answer correct? Why is this answer incorrect? Again, just an excellent, easy way for exam review preparation, where you're not having to generate something completely new on your own. As we wrap this up here, I hope I did an okay job showing you how I integrate it. And because it is so easy and students feel so confident using Davis Advantage, And the one thing I have heard from them is that it doesn't waste their time. I think it gives you more confidence as an instructor of trusting in its value for students and wanting to integrate it into your course because, first of all, the videos, the activities do not take a great deal of time. The personalized teaching plans are already set up for you. So there is this ease of integration that makes it a better classroom experience for you and your students. I do feel very much, because pathophysiology, as I've said earlier in this talk, has so much volume and content. I don't know how you feel as a teacher, but you just sometimes feel there's gaps with the students' understanding, and it so almost stresses you out because you've tried to have been so clear and so direct in what students need to know. Overall, I think the number one benefit I've gained from Davis Advantage is I find those gaps in knowledge to be significantly reduced in my students. I think it's because between my lecture, the Davis Advantage activities, videos, the personalized teaching plans, there are consistently 3 options available for students to be exposed to the material. If they don't get it the first time, don't get it the second time, boy, the third time we're working on it, those gaps have significantly reduced. And I think every instructor, especially the students we're instructing who we pretty much will know will move further on in their career, are just absolutely thrilled we're not sending them off with significant gaps in their knowledge. So I really appreciate your time today. I hope what I said made sense and gave you some inspiration perhaps for how you can incorporate Davis Advantage within your own course. Thank you.
Thanks, Kim. That was such a good overview, and really hearing from a faculty's perspective of why you use Davis Advantage and how you're implementing it in the classroom. And it's always great to hear about the positive feedback and the success that your students are having with this product too.
Great.
Wanted to take a second to see if that we had any questions from any of the attendees. So if anybody has any questions, feel free to put that in the Q&A box at the bottom right-hand corner of your screen. And let me review, I know some people on the call might even be using Davis Advantage. You might have adopted an F.A. Davis textbook. Davis Advantage is incorporated in the solution, and you might not have just accessed it yet. We can help you get started. We can also set you up with a demo with one of our amazing e-learning specialists. They can make it super easy to walk through the product, how to set up your class, how to select the content that you want your students exposed to, and walk you through some of the videos, the activities, and the personalized teaching plans. So let us know if you would be interested in a one-on-one, or if you have colleagues or yourself that just might need access to review, test drive Davis Advantage yourself. Fill out the survey or contact us at davisadvantage@fadavis.com. So let's see if we had any questions come in. All right, it looks like we have a couple. There's one about if you can use Davis Advantage for an entirely online course. And I'll start to take this one, but Kim, I'm going to toss it to you too. I know you might not be doing an online course, but just thinking how you would envision that working for a program. We do have entirely online courses that use Davis Advantage. The nice thing is, even though they're not getting face time, they're able to make those assignments, have their students work through the topic areas, and then when week to week, when the students already work on those topics, they're able to identify what the weak areas are and then focus more of their next week's lecture or plan around what their students are still struggling with. And even the personalized teaching plans, which Kim showcased, there's 3 different activities, and that really gives the soup to nuts of everything that you need. It gives the full activity, the description, instructions, any handouts, also the answers, so we don't leave anything out. It is very easy to use, and you can use it whether it's in class or these are different activities that you could assign your online students. It could be different class discussions that you could use some type of chat or discussion board. There's also different teamwork or case studies that the students could work through individually, or you could put a few students together to work on them within, once again, like a chat or something that they could meet and then bring it to next week's discussion. So let me just turn it over to Kim to see if you would have any ideas on the online course.
Yeah, and like I sort of at the end was indicating, I teach about 100 students online every year in PathoPhys that is just solely online. And Davis Advantage has transformed that class, because it can be so difficult to really make sure students are getting the content that you want online. You can certainly post videos. I post lecture videos, link to videos, things such as that. But that complete package, you always wonder what exactly are they getting out of this. Davis Advantage has helped me feel a lot more confident with my students online that they are getting the core content in a way that is delivered to them that they can put it together on their own, if you will. Not that students in an online environment are solely learning on their own, but I do think there's a little bit more of a gap present. As I've been saying before, Davis Advantage will help fill in that gap substantially. I think one of the fears always when you're dealing with a large number of online students is how big of a hassle, because of that distance, it's going to be for students to use, for example, a learning platform like Davis Advantage. Because it is so easy and intuitive for students, I handle very few complaints, if any at all, with Davis Advantage as far as them registering, getting their access, and all of that. Maybe one or two questions within the first week. FA Davis support seems to be phenomenal, getting students on track right away. So it is very easy to incorporate with online learning, and you're always welcome to contact me directly if you would like to kick around some ideas of furthering it as far as using it with online learning. But very quickly, as Jackie said, the personalized teaching plans, a lot of times I sort of cut and paste those and make them into assignments that I also post in my online learning environment, because they're excellent summary activities. I hope that answers your question.
Awesome. Thanks, Kim. I feel like that definitely helps, because it really just speaks to how flexible and how customizable the Davis Advantage product is. Kim walked through 3 different scenarios of how you can really work it for your course, but whether your students are face-to-face or online, you can absolutely, Davis Advantage isn't something you're going to be like, I love it, I hope that I can get it to work for me. It will really work for you. It is that easy. Let's check if we have any other questions that came in the interim, and if you do have questions, feel free to keep submitting them for myself or Kim. We have another one about that they're using Davis Advantage Pathophysiology and the online resources, but haven't accessed Davis Advantage, and is it included in the online resources? And also, in addition to that, do students have to make an additional purchase, or do they have access to the content? So if you have adopted our pathophysiology textbook, if you have adopted our medical surgical nursing textbook, or if you choose to adopt our basic nursing textbook that is publishing this month, your students are going to have access to Davis Advantage, and you will as well. Just as you get access to our Davis Plus resources, you get access to Davis Advantage to go in there and create the class that meets your needs and make those assignments for your students. Your students, if they purchase the printed text, there's going to be a scratch-off code on the inside front cover where they scratch it off. They'll put their access code into davisadvantage.com, and they'll get access to Davis Advantage and all the topics, all the videos, interactive activities, that pre- and post-assessment questions, and the whole personalized learning plan for 3 years. It is really invaluable. When we talk about our pathophysiology solution or our med-surg solution, and now our fundamentals, it definitely works hand in hand. It is the textbook working with this online personalized learning plan to really make sure that your students aren't just reading, going through the motions, that we're helping them apply, we're helping them make those connections, engage in the content, make sure it's accessible to your students so that they're really understanding the content and making sure that they're successful in school and beyond. Kim, you did such a good job in kind of relating the patho is just really difficult for students to learn. And we see that with Med-Surg, students are so overwhelmed, or even at the fundamentals level, they're new students. So sometimes students don't know what they don't know. And that's where Davis Advantage is really going to hold their hand and personalize their experience to meet their needs. It's going to showcase those weak areas where they need to take that deeper dive and make sure that they're understanding the content to move on. And Kim, I don't know if you have anything to add to that type of question, just from your experience.
No, I don't. I guess I would want to point out, I don't know what everyone's knowledge base is. You know, sometimes students don't want the hardcover book. They can also, for a reduced price, just order the online content. There's always an ebook that accompanies Davis Advantage, just ordering the online content. So that's another route to go. And I have more and more students doing that who don't want the hardcover, who just want the electronic or the digital materials.
Oh, that's a great point, because it is true. We do give different options. We have the print that includes the ebook and then the 3-year access to Davis Advantage. And we also have just the direct purchase of the ebook with the 3-year Davis Advantage option, which is really nice, because it really depends on where your students are comfortable with. And like Kim said, it's the ebook with Davis Advantage is for a lower price as well. So I don't know if we have any more questions that came in, but if any of you think of any after this presentation, feel free to reach out to us at davisadvantage@fadavis.com. And you can do that whether it's you just want access to Davis Advantage, you're looking for a demo with you and your colleagues to really get more into the nitty-gritty, or maybe something that you'd like to ask Kim, hearing more about her experience using the product. Feel free to email us at davisadvantage@fadavis.com. There's also more information on our website, but the best way to really see how it would work for you is to get in there, access it yourselves, play around, and see all of the exciting features, some of their functionalities, and really the great benefits that it will be not only to you, but also your students. So thank you so much for joining us today, and thank you again to Kim. She did such a wonderful job of getting into the ins and outs of using Davis Advantage, and it's always a pleasure to co-host with you and always hear about the experience that you're having. And we hope that everybody on the call that's using Davis Advantage, your experience is mirroring what Kim ran through, that it's making your life easier, it's making it less time for you to prepare, as well as getting your students engaged, getting them active, getting them connected more with the content. So thanks again, Kim, and thanks again to everybody else who called in. Have a good one.